Good afternoon, ladies and gentlemen. A very warm welcome to our viewers, healthcare leaders, doctors, policymakers, and technology professionals joining us today. I am Sumit Chaudhary from Amar Ujala, and it is my pleasure to host today's insightful session. Amar Ujala proudly presents the second edition of the healthcare webinar series, focused on a powerful and timely theme: technology in healthcare. Behtar Ilaaj, Behtar Zindagi. Across the globe, healthcare systems are leveraging artificial intelligence, digital platforms, cloud infrastructure, and data analytics to enhance the diagnostics, optimize workflows, and improve patient outcomes. In India, the digital shift carries immense potential to bridge healthcare gaps, strengthen preventive care, and ensure equitable access to quality treatment. Today, we will explore how technology leadership, innovations, strategies, and policy frameworks can collectively shape a resilient and future-ready healthcare ecosystem for Bharat, for our country. We are privileged to have an esteemed panel of industry leaders and technology visionaries who are the forefront of digital transformation in healthcare. It is now my honor to introduce our distinguished speakers, Dr. Sushil Meher. Dr. Sushil Meher is a distinguished healthcare IT leader and head of IT at AIMS, New Delhi, with decades of experience in digital health innovation. We are delighted to have you, sir, with us today. Dr. Sushil Meher, thank you so much.
Yeah, good
Our next guest is Mr. JP Dwivedi, as a distinguished industry leader and Chief Information Officer at Rajiv Gandhi Cancer Institute and Research Center, known for driving strategy growth and organizational transformation. We are delighted to have you, sir, with us. Thank you so much for joining us. Our next guest is Mr. Praveen Bisht. Professor Praveen Bisht, Chief Information Officer, CIO, Amrita Hospitals, is a leading healthcare technology leader driving digital transformation in a large-scale hospital ecosystems. We are delighted to have you, sir, with us today. Thank you for joining us. And the other prominent guest, Ms. Pooja Chatrath, is a Chief Information Officer at OnQuest Laboratories Limited with extensive experience in healthcare digital innovation. We are delighted to have you with us, ma'am. Thank you so much for joining us. And thank you once again to our esteemed panelists for joining us today. Let me now formally begin today's discussion, and I would like to start this conversation with Dr. Sushil Meher. Dr. Meher, my first question to you is, what does a smart hospital mean in the Indian public healthcare context, and how close we are to achieving it? Sir.
Yeah, good afternoon to everyone. My introduction already been given to you. Right now, everybody they are working towards the data-driven healthcare. It leverages your data analytics, giving advanced treatment plan, improve the operational efficiency as well as the patient care. And what is called smart? Why it is smart? Many people, they have at their home robots which has been cleaning their room. It is just like that, how hospital work in a smart in automatic manner. That is the one of the things which is been required in each and every hospital, because you know it, India has 1:1600 ratio, means one doctor every 1600 population. It is a big challenge that to cater all this size of population for healthcare. We need technology. Technology means the technology will intervene to reduce the doctors or healthcare workers' time and effort. That's why right now everybody, most of the organizations, they're looking towards that, how the technology will intervene. That's why they have made many medical equipments. It is interconnected and getting the data faster manner. That's one example I'm giving you. AIMS has a smart lab. What do you mean by smart labs? Only 2 places the manual intervention is required, and rest of the places is not required at all. First one is the doctor will decide what kind of test has to be performed, Another one is the sample collection. That's all. Rest of the things, everything will be done by the that smart lab. It is analytic labs. All the reporting will be done through AI analytic programs. Main sample has been reached to the lab. It is also automated. The pneumatics technology tubes are there. Through pneumatic tubes, all the samples that travel to labs. Inside the labs, the robotic hands, it is already been trained that which sample will go to the which laboratory equipment for test. That will be decided by the robotic hands, not by any manual hands. Then when we'll go to the lab, sorry, when we go to the instrument test it, report it to the main database, analytic programs, analyze the reports, and whether this report is correct or not. That is be decided by the only analytics, not by doctors. Of course, doctors, man in the middle is there. At the final, the doctors has to be recommended. So these are the whole process which was taking, at least in manual system, it was taking 12 hours. Right now it is taking less than 1 hour. So what kind of time we are saving, you see, if you do the smart labs. This is the one example what I have given it. Second part is that when when hospital is smart, when the patient will come, means his appointment is ready, he has to go to which department, the computer will advise you that this is the department you should go for treatment. Because we have observed that more than 32% they landed in a wrong department in the first time visitor. So that is also reduced. Second part is that if you want a parking, automatically the parking slot will be alerted to you. You need wheelchair, automatic the wheelchair will be alerted to you. You need a stretcher, the stretcher has to be alerted to you. Smartly it will work. It will be good experience to the patient, those who are coming to a large hospital, and most of the hospitals in the city or tier 2, tier 3 or tier 1 any other city, it is overcrowded. If things are moved very smoothly in order, definitely the quality of healthcare and patient experience will go improve. So this is my some of the examples which I have given to you.
Yes.
Over to you. Yeah.
Thank you. Thank you, Dr. Mayor, for outlining such a comprehensive vision of a smart and digitally integrated healthcare system. Your insights clearly highlighted how technology can redefine efficiency and patient care in the public institutions. Building on that perspective of digital transformation in hospitals, I would now like to bring Mr. JP Dwivedi in the discussion. Mr. JP Dwivedi, which digital technologies such as AI, EMR, telemedicine, cloud computing, or data analytics are currently making the biggest impact in the cancer care and hospitals operations? What do you think?
You have named all the technologies, Sumit. We need to understand the perspective. Technologies are really layered. So you look at the ground level, look at the foundation level, then at the structural level and utopian level. So you mentioned cloud or on-premise infrastructure, AI infrastructure. These are all ground level requirements of the technology to build the basis for the next level. And the next level is the foundation level, where we put electronic health record system, telemedicine, basic analytics based on the structured data. These are the foundation level technology interventions. The next level is the structural level, where we work on process automation. We work on adoption of AI in non-clinical areas, some bots and agentic AI, etc. And then comes the utopian, where we put AI in the clinical areas, where AI is helping in deciding the diagnostic panel, deciding the treatment protocols, etc., giving the clinician a decision support, helping in diagnosis. So these are the utopian level usages of technology. Now, all these technologies combined together and working, like Dr. Meher said, man-machine combination has to work optimally in fully integrated manner to deliver the optimum results. Healthcare is in dire need of deployment of technology But we are also laggards, unfortunately. It will not remain the case for long because hospitals are fast catching up, and the technology that is available today was not available 5 years back, 2 years back, or even 1 year back. So you will see a lot of dramatic changes in technology deployment in healthcare for good of the humanity. Over to
Definitely,
you.
sir. We are continued developing in the scenario. And thank you so much, Mr. Devedi, for sharing those practical insights for the cancer care ecosystem. It is encouraging also to see how structured digital adoptions is already improving outcomes and operational efficiency. Taking this conversation further into the large scale healthcare institutions, I would like to now invite Mr. Praveen Bisht. Sir, how is artificial intelligence transforming diagnostics according to you, clinical decision support, and hospital management in the large healthcare institutions?
Okay, great questions, and good afternoon to all the audience. Um, Regarding your question regarding how AI is actually helping and being implemented in a large healthcare institution like Amrita, you specifically mentioned three different cases. You mentioned about diagnostic, you asked about clinical decision, and the hospital operations. So uh, currently, AI is at different levels when it comes to maturity for each of these three areas. So when it comes to hospital operations, typically these are non-clinical, more administrative kind of operations. So here AI has been implemented from a fairly long time, I would say. And a lot of audience would have heard of this term RPA, robotic process automation, and Diviji ji also mentioned in his speech about these applications which are at the top level but at the operational side of things. So those have been successfully implemented for fairly long time, and these are dealing with day-to-day operations which can be automated so that your manpower requirement is less and you get some efficiency gain for sure. But there is no clinical intervention as such. Then the second tier or the maturity level, I would say, is on the diagnostic side, and I guess all of us are aware that AI has made tremendous advancement, especially in the areas like image recognition. And a lot of diagnostic, especially in radiology department, they rely on these images. So we get these DICOM images, for example, X-ray, MRI, CT scans, and these images are essentially read by a radiologist in a traditional hospital. But more and more, it has been seen that AI models can be trained enough so that they're able to distinguish the minute of the differences and can do a much better job in terms of reading those images and then giving a report. And systems are there, we have already implemented, but it is not standalone, so it has to be human assisted. When I mean human assisted, AI model will look at an image, it will do its job, and it will prepare a report, but that report has to be read and vetted and validated by a radiologist before it is released out. So it is being used, but in a limited fashion, human assisted as we speak. When it comes to clinical decision, so clinical decision is a little tricky. We have seen plethora of models, but primarily these has been more driven and trained by data sets which are more western countries driven, right? So you have Europe, all these countries have multiple models which have been trained on their data, and India unfortunately is little lagging behind. We are like others have also said, we are catching up, but we still need much more clinical data of Indian origin for us to further fine tune our models on these data sets, Indian data sets, and then they can be successfully utilized. So we are doing multiple POCs. We are working on a lot of these projects, and we are seeing good results. And one thing that we are also doing is utilizing the OCR, which is the handwriting recognition and speech recognition. These are the two technologies which has been fairly advanced, just like image recognition. So you have handwriting and speech recognition, which is being utilized to convert either handwritten notes of doctors and nurses. So that converts paper into digital data. Also, the conversation that a doctor is having with the patient can also be easily transcribed and used by our speech recognition to actually convert that into a digital data. So earlier we used to say that Indian hospitals lack this treasure of data, but that is being gathered as we speak. So we are utilizing these AI models, which have been proven to convert some of the non-structural or non-digital data and making it digital, so that we can make use of the AI models, train them, fine-tune them, and then we eventually use them for clinical operations also. So overall, I think we have come a long way, and even a small implementation of AI can result in a big change when it comes to a bigger operation like Amrita Hospital. So thank you again for this excellent question.
Absolutely, sir. There is still a great, as you say, that there's still a great deal of work that needs to be done. But thank you, Professor Bisht. Your perspective clearly shows that how AI is moving from theory to real world implementations in hospital ecosystems, from institutional transformations. Let us now shift focus slightly towards patient experience and diagnostics. And Ms. Pooja Chatrat, thank you so much for being patient. And because I'm coming lastly to you. Ms. Chatrat, how can technology enhance patient experience? From appointment booking to receiving reports and follow-up cares. What do you think?
Well, that's a powerful question, I would say, and especially when the focus is on diagnostics and interoperability in India. So, if designed well, I believe technology can transform the entire patient journey from transactional to trusted and outcome driven journey. So, that's my take on this. And I'll just break down this journey, how we can see the full cycle and how technology can help in this full life cycle is we start with the booking and the discovery phase. That is first thing wherein the patient comes and interacts with the any of the healthcare organization. So if the booking is frictionless booking, whereas we have one click scheduling, we have real time slot availability, dynamic pricing transparency, and as well as with the integrations which are coming with the UPI wallet and EMI payments. So what happens is the journey, the first phase itself becomes very easy for the patient, and surely it gives an experience wherein they feel like going again and again with the same healthcare partner, wherein they get such kind of experience. Now, post this, once the booking is done, we have a facility wherein pre-test preparation automation is done, which is like once the booking is done, maybe the slot is after 2 days or 1 day, the appointment depends upon the timelines. So WhatsApp reminders can be sent. If I talk like I being a part of diagnostics, so in diagnostics, so suppose if a lab test has to be done, so the fasting alerts can be sent, as well as going we can also ensure that patient journey can be enhanced if we give the location tracking maps, because in this way the comfort is given to the patient and the experience is enhanced. Also, going forward from booking, this next step becomes a sample collection. Now the sample collection could be either if the patient visits the lab, or it could also be wherein the patient is at the home and actual the real anxiety is there. So how we can help in reducing that anxiety. So wherein technology, what technology can do is we can have a digital check-in, we can have digital consent forms. Zero paper workflow actually helps in easing the anxiety of the patient and I would say saving the time as well. So the process transparency overall, it helps in creating a better technology phase for the patient. Going forward, once the sample is collected, now the next journey comes is what has happened to my sample, where we give a real-time tracking. So the technology is helping the patient to track where actually the sample is. So if it is home collection, so has the sample reached the lab? Has the processing started? Is my report under validation? Is my report delivered? So all different types of tracking, if either on website or through SMS or through WhatsApp, whatever way we want to communicate with the patient, if that is done, that helps the patient in easing the phases that the patient goes through during that lab test. Uh, we also use Flebo apps for as a technician enablement process, wherein the Flebo app has a integration with our limbs and real-time status, as well as the payment integration is done on the app, which helps in easing the process further. Now, if I talk about now what happens if the report is generated, most of the labs right now, what is happening, there's a static PDF, there is no explanation, no trend analysis. But technology, wherein how technology can now help over here is when we start creating intelligence report. So by intelligent reports, I means is we have smart reports, we have reports wherein the analysis is there, the highlighted abnormal parameters are enhanced, visual trend graphs are there for the patient, for making it more understandable to the patient. Then as I talk about, from if I am a part of IT, I am not a doctor, so how do I interpret my report, or how do I understand my report? So the layman's summary versus the doctor summary, this surely helps the patient in a better way to understand the entire report. And surely the last part, the last leg is how ABDM is helping, how the Ayushman Bharat digital mission is helping, wherein there is the one longitudinal patient record which is formed. If we directly link our entire journey with the ABDM APIs, surely we have a single path wherein everything is linked, and a patient has a free flow journey. Any of the labs they go in, any of the hospitals they get the analysis, but everything would be related with one health ID, and they'll get everything under one roof. This is till the time where the report is generation. Now, again, how the patient journey can be enhanced once one time the test is done, and how we can enhance is how giving the post report engagement with the patient and the follow-ups. So surely bots these days are helping a lot. We have once the data is there in our LIS or HIS, we can uh, keep sending the reminders, wherein patient also feels valued, that somebody is sending them a reminder that after 3 months or after 6 months your this test is due and you have to get it done. So somebody is there to take care of you. And again, not only this, there is also the consulting that has been started. So if your diabetes level has increased, or if there's a cardiac risk, so how you can engage with different nutrition consulting bookings or your cardiologist referrals, so that can also be done. So such kind of engagements help enhancing the patient journey overall. So I believe is that the future for diagnostics is basically diagnostics as a continuous care platform.
Wonderful words. Thank you, ma'am, for highlighting the patient-centric dimensions of the digital healthcare. Technology truly becomes the meaningful when it simplifies the patient journey, what you tell. Now, Dr. Meher, if I may come back to you, we spoke earlier about smart hospitals, sir, and digital transformation. Taking that vision a step ahead, what steps are required, do you think, to create a unified digital health ecosystem across public and private hospitals in India?
See, just now we have spoken that patient-centric. If you are talking about patient-centric, we have to have a swamp framework. And that framework already been, the government has already been implemented. That is Ayushman Bharat Digital Mission. They have given different blocks. The doctor or health workers has one block, hospital has one block, the diagnostic centers and other service provider one block. Another one block is that pharmacy is the one block. They have created it. It means that any patients who has to come, if he's come through the ABDM, Ayushman Bharat Digital Missions, they create a ABHA ID, Ayushman Bharat Health ID. And this is unique. But problem is that health is a state subject. If some states do not like to adopt the Ayushman Bharat, nobody put the question of it. That is one of the big challenge for it. And majority of the hospitals or healthcare service providers are not adopted the Ayushman Bharat Digital Missions framework. Because when we're talking about the patients, what patient needed it? patient needed, whenever he's required, his record supposed to be available with him, because patient is itself is the owner of his own health record, not the hospital or not the any service provider. So a service provider or hospitals are custodians. They can keep your records safe, security, and confidentiality has to maintain. These three principles already in the law. But when you use this framework, then you will get a unified health records. What is that? Records right now it is staying, or you are keeping in the individual hospital what they have performed. That can be shared through ABDM framework, that is HIE, Health Information Exchange, through to transfer the health record to the patient itself. Right now, there is no provisions, or people have not adapted some standards. That's why it is not possible to do the health record interoperable. Means when I am showing in AIMS, and after 2 months I want to show somewhere else in the X hospitals, so my records cannot travel to that hospital. After that, I'm giving the permission, because both the applications are not standards. If the APIs are available also, if metadata is not matching, it is very difficult to transfer the data from that hospital. So ABDM has decided the records, whatever it is generated, it will be stayed there, and patient has empowered, has given to them to assess it. But if the service provider is not compliant with the ABDM, then it is not possible to assess it. This is the one of the big challenge what everyone is facing for this. If this regulatory has to be changed, that they will enforce each and every organizations to adopt ABDM, then we'll get a clear picture on that how it is powerful, that health records it is being kept in a centralized manner. Thank you.
Absolutely, sir. Thank you, Dr. Meher. As you rightly pointed out, integration and interoperability are centered to the building a truly connected healthcare system. Now, while the vision is clear, implementation often presents challenges. Mr. Dwivedi, let me bring you in here. What are the biggest challenges healthcare organizations face while adopting AI-driven solutions, and how can they overcome them?
So, very first thing, AI shares a very common human weakness that we all humans have. And it has tough time saying, I don't know. So when it doesn't know something, it cooks up and it creates something that is called bias or hallucination. In healthcare, it is very dangerous because 99.9% accuracy will not do. You have to be 100% accurate with 100% confidence because you are dealing with human life. So this is one aspect. The other aspect is you look at the AI ecosystem, you will find 4 type of potential partners that you want to work with. Type 1, they have some vague idea, half-cooked product. They want to mature it. They want to finish the product with you. They will give you the lucrative offers to co-create and all that. And then you start working on a very enduring long journey. Future is uncertain. Second is that, well, they have the product, but this product is not trained. The model is not trained on the data. Maybe it is trained on European or Caucasian data. They want to mature it with Indian data and your data. So that is why they are coming with you. Interest is not to solve your problem. Interest is to mature their product. They will also offer you lucrative pricing. But now comes the DPDPA or other provisions where we are very, very careful about sharing the data. So data sharing, another becomes huge problem, and partners will not be willing to deploy the solutions in-house in general. Now we come to a choice that we have our own AI infrastructure. Now it is very, very expensive. So we need to very carefully triage really what solutions, what use cases we want to deploy. And then progressively we need to move towards AI deployment. I mean, I tell you one thing, would you really like to be treated by an AI doctor? Touch and feel cannot be replaced. Medicine is more of an art rather than a science. And the soft skill area that really doctors are gifted with, it will not come easily with AI. It will eventually come, but it is a long distance to traverse. Finally, some basic fundamental infrastructure is required. So unless you have a good electronic health record that is running for some 5, 6, 7 years, you have a good clean medical data. Now your AI model will run on the garbage, and then garbage in, garbage out. It will not produce the outcome that you are expecting out of it. So work systematically, as I said, the ground level, the foundation level, then at the structural level, and then you look for utopian level. That is the clinical deployment of AI.
Absolutely,
Over
sir.
to you.
Thank you, Mr. Devedi. That insight highlights that the successful adoptions depends not just on the technology, but also on the leadership, training, and the mindset. Building on that thought of overcoming barriers and accelerating change, Mr. Professor Bist, from your experience in the large healthcare institutions, what are the key barriers do you think Indian hospitals face in adopting advanced digital technologies, and what strategies can help accelerate digital transformation?
Okay, again, very, very relevant question. When it comes to digital technology, of course, today the most heard term is AI, which we already have spoken enough about, and it is going through this curve. There is a famous curve called hype to hope. Every product, it has its own peak, which is the highest point in hype. It goes down and finally adoption will increase, but it takes long time for it to mature. And I think AI is also going through that challenge, that curve, hype to hope. But in terms of overall, I think the biggest challenge today is having trained resources, because AI as a technology, as a tool, is fairly new. If I were to do, say I want to open a new specialized center in oncology, I will ask for trained resources, trained technicians, trained doctors. But here we are talking about a technology which is not so old, especially the newer part. Obviously the technology has evolved over multiple decades, but the last 3 to 4 years have been really the wow moment, so to speak. Especially we have all seen how ChatGPT has brought in AI in front of a typical citizen. It has really made it public, so to speak. Earlier also AI was being used, but it was used by a very few people. More technical nuances were there, but now it has become more of a tool in the hands of a common person. So that being said, it is a fairly niche technology. Knowledge is not so prevalent. So having a good trained resource is the biggest challenge. And that being said, we also need to make sure that our management also are made aware of the pros and cons. Just like any other technology, AI is no different. There are a lot of investment required, a lot of planning has to go into it before you actually deploy a solution. And if you just do a hearsay kind of a decision where you jump into, okay, everybody's talking, always work your way, it may not always pays off. So planning is very important. Having a good understanding, end-to-end understanding, you should have clarity of what is your end goal that you want to achieve. Of course, the tools that you will use to achieve that goal could be different, because technology is evolving and there is no single solution that we can call as a right solution. But that understanding has to be there, the path has to be laid out, and then you have to work in a peaceful fashion to achieve that. And slow and steady is what I would say is the mantra of the day, because if you try to leapfrog, you don't know how fast the technology itself is changing, the goalpost is changing. So we have to be extremely careful while navigating through this path towards our final objective. So to that end, in fact, I just want to add, Amrita being not just in a hospital, it's a educational institute. We have started a very specialized program, AI in healthcare. So we do offer BTech, MTech programs, wherein the students are given first-hand exposure. They're actually working with doctors to work on some real-life projects. So that gives them the good experience, and hoping when they graduate, they are the best suited folks to be able to work on some of these projects and actually deliver value. So I think trained human resources is the biggest challenge, and capacity building is a solution.
Definitely, sir. And Amrita Hospital also doing a very great work in the field. And thank you, Mr. Bist. Clearly, structured planning and long-term commitment play a vital role in sustainable digital growth. And finally, while systems and institutions are important, the ultimate goal remains patient well-being. Ms. Chatrat, what role does data analytics play in predictive and preventive healthcare in India, according to you?
So, well, this is again a question very close to my heart because I believe playing lot on data and analytics subject, which is very close to my heart. So, and especially if I talk about in Indian context, what happens is disease burden is high and the preventive adoption is very low. So in India, data plus analytics act as a bridge between the reactive sick care and the proactive health management, if I quote it in one line. Now, I'll just break down it structurally how the predictive healthcare as well as the preventive healthcare is required in India and why is it required so urgently. Now, if we talk about the lifestyle diseases, like we have rising diabetes, we have cardiovascular disease, which is again we see the number is increasing. The news channels we are seeing every day, even if the people are fit, still they are getting the attacks. Then late stage oncology detection. Why is it happening? Because of high out of pocket expenditure. Then fragmented records across providers. All of us talked about ABDM and we talked about National Health ID, but actually that is not happening. And again, low continuity of care. So India has lot of data, but I would say it has very little of it is being used longitudinally. And that is the reason that we are not able to get into a predictive or preventive healthcare, and maybe a lot of people can be more better survived if predictive healthcare comes into action. Now, what role does predictive healthcare play? I would say is that if we use lab trends, we use vitals, we use prescription patterns, or maybe nowadays, because wearable data is again a lot of capturing of wearable data. Everybody in urban cities, they've started wearing wearable devices, and their data is also being captured. So analytics in this case can predict maybe if I take an example of diabetes, so maybe diabetes onset 3 to 5 years before diagnosis, or maybe cardiac event probability can be judged, or oncology risk clusters can be pre-informed. So like I was just having a discussion with our internal team only. So through the trends of like fasting glucose as well as with the family history and BMI reports, these days we've started predicting that pre-diabetic risk trajectory is there. So this is what is predictive healthcare, and surely it's, if we use this data in a right way, predictive healthcare is one strong way wherein we can enable lot many things. Now, how we can take care of the preventive care through these early signals would be like I said, personalized screening protocols. If we use, instead of generic annual checkups, we start using the preventive pathways. So what will happen is we could have the automated flow follow-up reminders, we could have teleconsult integrations, we can have lifestyle modification programs. So basis this, we can have a lot of dynamic preventive pathways going forward. And again, I would suggest is that ABHA ID and the unique opportunity which India already has taken through our digital public infrastructure. We should utilize this. We should enable the ABA ID so that the longitudinal health record exchange can be done, and this would surely help in properly adaptation of cross hospital risk tracking, early disease surveillance. These are some of the things which would surely help us. And these are, I think, some of the things wherein predictive as well as
Absolutely.
preventive care can be taken care of. And surely, if we talk about the labs or from diagnostics or from the hospital points, surely this can help in better capacity planning. It can help in transitioning from test provider to actually risk intelligence partner. Labs can be acted like that.
Absolutely. Thank you, ma'am. Thank you, Mr. Chatrat. That perspective truly brings the discussion back to its core purpose: better outcomes and better lives. We have discussed vision, implementation, institutional challenges. Let me now move to a discussion towards the future roadmap and long-term impact. Dr. Meher, from a policy and governance perspective, what policy level reforms or government interventions are most critical to accelerate digital healthcare adoption across India, Dr. Meher? And my request, if possible, I would request you to keep your response concise, sir. Dr. Meher.
Friends, yeah. Hello, it is clear to you?
Yes, sir. Yes, sir.
Yeah. Right now, already I have spoken about the data-driven healthcare leverage to the data analytics and the advanced technology, which is enhance the patient care and improve the operational efficiency and drive the inform the decision making in the healthcare organizations. You see, technology is not a issue, not an issue. Issue is that how it will be implemented. Second part is the data. If data is already been, one of the friends we have already informed that data has to be clean, unbiased, and standardized. Another one I'll add it, the complete health records. It should not be any missing data supposed to be there. Then you can have a AI model who is supposed to work for you. And it has been already been observed. Many research paper it is showing that people have tried their level best to implement a good AI model and they failed. And as per the data, 95% of the AI model across all the domain, they failed. And in healthcare, it might be more. We do not have any data on this. So what you have to believe it? That is one of the questions. If we talk about the AIMS work in 4 models. One is the curative, preventive, personalized. Another one is your predictive and population. Majority of the people they work on, that is the curative model. Curative model means patient is coming, you are doing the investigation, test it, you are doing the medication or surgery, anything you are doing it, and they are leaving it. That's all. But AIMS work another 4 extra models, that how it can be prevented. Why last 5 to 6 years we do not have the dengue or chikungunya in NCR? This is the preventive model. It has been applied. It is worked with the different agency, and there is no such kind of epidemic in the country, because we have got a good quality of data and we have applied the models that how it will be preventive. Preventives generally those who are in the public hospitals or research institutions. Second part is that you are talking about the technology. See, if you talk about technology is not a limit right now. Everything is available to you. If you talk about the electronic records, it is available, but it's not standardized. We have wearable devices. Bypatches is there. Real-time data you can capture through your mobile or through your IoT devices is connected within the hospitals. Data is coming, large scale of data is coming, but that data is required to proper model to integrations. That is the lesson for this. Yeah. And lastly, that's why government has recommended that AIMS has to develop their own model and test it in own data. Then it is possible that how the model is behaving. One example I'm giving to you. We have developed one of the very national level project is ioncology.ai. It's early prediction of breast cancer and ovarian cancer. And it is available to all the public hospital as well as the government hospital. And already 10 hospitals already they have adopted it. But how this model has developed it? Around 4,500 patients data, it's required around about to be 3 years to clean the data, complete the data, and standardize the data. So that is the challenge, and that is very time consuming and expensive.
Absolutely. Thank you, sir. Thank you, Dr. Meher. Now, as digital expansion increases, one important concern naturally comes into the focus: data security and privacy. Mr. JP Dwivedi, how can healthcare institutions ensure data security, sir, and patient privacy while expanding AI and cloud-based healthcare systems, according to you?
A very pertinent question, Sumit. This is actually the most important aspect where even technology is getting hurdled. So, what I would say, we need to adhere to certain basic hygiene factors. Now, where all this security or privacy could be breached. It could be while we are acquiring the data. It could be while we are keeping, storing, and processing the data, or it could be while we are transmitting the data from our data center to any third party providers, how mature their processes are. So, certain frameworks which are already there in place, for example, ISO 27001 or 27701 frameworks for the data security and privacy. These are basic frameworks that should really be adhered to in letter and spirit. Every stakeholder is responsible for data security. It is not only the administration or the IT or the clinical. From any station, the leakages can happen knowingly or unknowingly. So our policies, our practices, our governance framework, our technology, everything has to be in place. Awareness is very important because we are as strong as our weakest link is. And weakest link generally is our third parties, the small service providers who process our data either in the name of AI or in the name of the advanced analytics or any other areas of data processing. We need to be very sure, not only from contract point of view, but from even audit point of view, we should be confident that they have adequate processes, technologies, and governance model in place to keep our patients' data safe and secure. We even need to educate patients also. People take pride in talking openly about their health problems. You might have heard your glucose level is 150, so what? Mine is 350. Even that is a matter of pride. And when people talk about their health data so openly, we are vulnerable as a society. So a lot of awareness, education needs to be there. Government is doing a lot of work. We all need to join hands and work in strengthening this data privacy and security.
Absolutely, sir. Very important. How important is capacity or building a digital training in the now scenario? My next question is to Mr. Praveen Bish, sir. Sir, how important is capacity building and digital training for the healthcare professionals in making the technology truly effective?
I think it's we cannot lay enough emphasis on it. I think it's very, very critical. And in fact, it's not just the engineers that we need to get trained on, the medical school students, the MBBS students that are coming out should also be equally exposed and trained on what are these new budding technologies which can be of great help to them. But also on the side of it, we have to also inform them, make them aware of the challenges, especially when it comes to data security, data privacy of it. And to that effect, we have actually started implementing some of the weekend courses for some of our medical students. So I think over time our NMC will also make it mandatory across the board. But it is we cannot just lay enough emphasis that capacity building will be the biggest reason if we were to succeed or if we were to fail. If we are able to do it successfully, then I think we will win this race of AI, because India has a very mature, technologically savvy, English speaking, and possibly like the force that can change the world, that can take the world with the AI application, AI implementation. At the same time, if we don't leverage it, if we don't channelize it, it can also be one of the reasons for failure. So we just have to be very clear in terms of how do we utilize this opportunity and leverage this the movement that we have. Digital transformation movement can be easily captured if we do the right things, and government is doing their part. I think there are some of the small projects like Kayota Foundation. They have done a tremendous job in this area with trying to standardize some of these frameworks, and such projects, such initiatives should be expanded further to give it the national importance.
Yeah, absolutely. Thank you, Mr. Bisht. And finally, bringing our focus back to the term patient impact. Ms. Chatrat, in the next 5 to 10 years, how do you see predictive and preventive healthcare reshaping India's overall healthcare system?
Well, surely next 5 to 10 years, there would be a lot of, I would say, patients coming up and opting for predictive and preventive healthcare. Because, if we just see the journey, like my peer members also mentioned, last 5 years where the technology was or where the health monitoring was versus what we are today, or if we just monitor last 2 years versus where we are today. So there's a lot big transition which already has happened. People have started opting for technology. They have started opted for the preventive healthcare. Earlier it was like curative healthcare, wherein once your diseases is diagnosed, then you go and opt for the test and all. But these days, surely the patient as well as the companies itself, I would say a lot of corporates, a lot of Indian population has now been more attentive about their health. Post COVID, this has surely happened a lot, and in next to 5 to 10 years, I think this would become one of the mandate which everybody would start following. And with AI coming up, which is one of the technology which will surely have the maximum system impact going forward. And in another 5 years, we would have a lot of use cases already in healthcare which would be working with AI. So analytics and artificial intelligence surely will help us in making decisions and making more of the healthcare as a preventive healthcare mechanism.
Absolutely, Ms. Chatrat, and that forward-looking vision truly captures the direction in which Indian healthcare is heading. And thank you so much. As we conclude today's engaging and insightful discussion, it is evident that technology is no longer a supporting function in healthcare. It is becoming a backbone of the modern medical systems. From the vision of smart hospitals and unified digital ecosystems to the growing role of artificial intelligence in diagnostics and cancer care also, and from patient-centric digital platforms to the power of predictive analytics. Today's conversation clearly highlighted that the future of the healthcare in India will be driven by the innovation, integration, and intelligent use of data. I would like to extend my sincere gratitude to Dr. Sushil Meher for sharing his valuable insights on building smart and digitally integrated public healthcare system. Thank you so much, sir. Mr. J.P. Dwivedi for explaining how advanced digital technologies are transforming cancer care and hospital operations. Thank you so much, sir. Mr. Praveen Bisht for highlighting the real-world implementation of AI in the large healthcare institution, and Ms. Pooja Chatrat for emphasizing the importance of the patient experience and predictive healthcare through data analytics. Thank you once again to all our distinguished panelists for enriching this discussion with your expertise and perspective. Thank you so much. On behalf of Amar Ujala, I also thank all of our viewers and participants who joined us today and contributed to this meaningful dialogue. This webinar is part of Amar Ujala Health for Bharat initiative aimed at fostering impactful healthcare conversations and driving positive changes across the country. Stay connected with Amar Ujala for more such knowledge-driven sessions. Thank you once again. Have a wonderful day. Thank you so much.